L'UFR Santé et le CHU de Rouen ont accueilli les 24 et 25 mars 2022 le deuxième symposium international sur la médecine de précision. Soutenu par le campus Santé Rouen Normandie, l'événement a réuni des experts internationaux dans les différents domaines de la médecine de précision. Plus communément appelée la médecine des 4 P, la médecine de précision s'appuie sur 4 piliers. Elle est prédictive, personnalisée, préventive et participative. Cette nouvelle approche est centrée sur l'individu par rapport à l'approche conventionnelle dans laquelle les stratégies de traitement ou de prévention des maladies sont basées sur une personne moyenne, fictive, représentative de la population générale. Ce concept tient compte des variations individuelles de chaque patient, qu'elles soient cliniques, biologiques, environnementales et sociales. Elle vise à valoriser les données nécessaires pour la gestion ou la prévention individualisée des maladies.
Je m'appelle Harald Schmidt, je suis un docteur médical et une pharmaciste, mais c'est le maximum de français. I work at Maastrich University and I have moved now from classical research to precision medicine in the past years. Well, the precision medicine in the moment is the answer to the imprecision medicine that we currently have. So we basically do not understand most of the diseases. Therefore, we have to wait until symptoms arise. We name the disease after a symptom, and then we treat the symptoms. But because that does not cure the problem, the diseases become chronic. So we have lots of chronic diseases, but they are chronic because we didn't know the cause. It's like if you would bring your car to a mechanic and the mechanic would say you have to every 3 months bring your car again because it's chronically defect. You wouldn't accept this, but in medicine we still do. Yeah, it's not something where we talk about the future in 10 or 20 years. There are a lot of things patients or not yet patients can already do. You can, for instance, get your genome sequenced. Then you will benefit from every new knowledge that is generated in the next years. You can use symptom checkers so that you don't rely only on your medical doctor about a diagnosis. You can go pre-diagnose there. And of course, you can do prevention. Lifestyle prevention is in 80% of the causes of a chronic disease. So that's almost the best thing. Yeah, medicine is already quite interdisciplinary, but precision medicine even more, because we're now working with mathematicians, with computer programmers in the lab. I never had that in my group before. Now I have mathematicians in my lab. And a meeting like this one, where you bring all these disciplines together, is almost for me like a homecoming meeting. Normal medical meetings are still based in organs, and I'm always the disruptive guy in these meetings. Here I have the feeling it's basically a homecoming conference.
Cet événement scientifique majeur permet de tisser des collaborations entre les professionnels de santé et de faire évoluer les pratiques en termes de numérique et d'intelligence artificielle.
So I'm Shrike, Zhang, assistant professor at the Harvard Med School and associate bioengineer at the Brigham Young Hospital. Our lab has been really working on biofabrication perspectives, primarily bioprinting and organ chip devices to allow fabrication of human tissues and organs for different applications. Yeah, biofabrication basically means the use of cells and possibly associated biomaterials to allow generation of functional tissues and organ type systems to allow emulation of the human counterparts for their functions and downstream applications. Yeah, so as mentioned, I mean, biofabrication can be potentially applied to different aspects. So one thing is 3D fabrication of these human tissues and organs, and if you then apply those towards, for example, let's say different donor patient-derived geometries of the tissues or cell types in there, then you can start to really personalize this medicine according to different patient needs. So that's one aspect, but also another aspect to mention this organ-on-chip devices, basically in vitro models of human tissues and organs, where you can also imagine you can combine them with cells that are coming from different patients, different donors, different people, populations, and then allow them to really promote our capacity to screen drugs in a better way. So those are perspectives I think might be relevant to precision medicine with biofabrication.
L'implantation de la médecine de précision dans la pratique clinique nécessite une profonde mutation des pratiques médicales, tant dans la formation des praticiens aux nouvelles technologies que dans leur adoption dans la pratique quotidienne.
I'm Nele Brusselaers. I'm a clinical epidemiologist. I'm a medical doctor by training, and I'm a researcher doing lots of research in the microbiome field and also on long-term effects of commonly prescribed drugs. Well, I think nowadays in medicine we have made huge advancements already, and we can treat the large majority of diseases, but there are still many diseases that we don't have an answer for, that we can't treat, many chronic diseases that we just keep treating with drugs. And for me, precision medicine may be a solution to also treat those people, to get them back in a more healthy state, which can be, of course, be beneficial for a very long time and for many, many people, although we can do a lot in medicine already. There are really things which are implemented, but for those it's often without a solid basis of knowledge. For example, probiotics, prebiotics, it's a hype, it's a big market already, but there is not enough research to really show that it works. So I think we need to have a more solid research first, and it's not only the probiotics, we also need to restore our microbiome ourselves, for example, by limiting our prescribed drug use, living healthier. If those factors are not in place, I don't think any supplement will do the trick. So we do need to understand everything better before we can really implement it, but it has a very big potential in women's health, like for example to prevent preterm birth, also in cancer treatment. Will cancer treatment work or not? So those are, or in chronic diseases, obesity, metabolic diseases. So there is a big potential, and so I do see that, I do foresee that there will be microbiome treatments in the near future. Some of them are already there, but then it's a very fast evolving field. I think it's already wonderful that there are so many clinicians and also students who will become active clinicians in the future are participating in events like this, because they are the next generation. They will be treating us and our family members in not such a distant future, and now they already know what's going on, and they will be the ones who need to convince their patients and the public as well to live healthier, to use treatments, and hopefully, I always hope that clinicians do have a solid research training as well, because that's also something I see in research, that it's often still a bit of a translation problem between the basic researchers and the clinicians. Both groups are excellent in what they do in daily life, but they do often have some communication problems. So it's very good that events like this hopefully fill that gap and make it easier to communicate, so to reach the research to a higher level.
Cette rencontre fut également l'occasion de sensibiliser la communauté médicale et scientifique, ainsi que les responsables institutionnels, aux opportunités et aux défis de la médecine de demain, dans un seul but, améliorer la santé humaine.